minutes?
Move approval.
Second? All in favor?
Aye.
Aye. Okay, and second, move to approve second minutes on December 18th, 2023. Do I hear?
Move approval.
Second, so approved. Thank you. All right, we'll move on to number 4, which is the financial report for October 2023.
Thank you, Chair. I'll just go over October. It's Ms. Smith's first official chair meeting, and it is the best financial profit that we've had in my 7 years, I think, here, so she must be good luck. So anyway, we'll walk through the financial statements. For the month, our inpatient volume was pretty strong, 222 admits, above budget, above the prior month. Our observation admits were a little bit above budget. Patient days were right at budget for the month. Our length of stay was commendable, 4.1, so we've had a lot of improvement in that space. Year to date, we're about 20% better than what we budgeted for length of stay. That's like golf, you want that number to be lower, not higher. Let's see, emergency room visits, that's the one thing that was down a little bit for the month, about 5% behind budget, a little bit behind last month. But the admissions out of the ED were right on the budgeted number at 167. Our clinic visits bumped up almost 450 from last month. Still slightly below budget, but still a big swing back for us in October. Surgery and outpatient surgery cases were close to budget, still not sterling, but in line with what we've been doing in recent months. Cath lab business was down a little bit last month, but right at its budgeted numbers. And our deliveries, newborn deliveries, were actually up last month. That's been kind of a roller coaster for the last 4 months. Year to date, we're a little bit behind where we were in deliveries last year. But last year, our deliveries were up almost 20% compared to the prior year. Case mix was a little bit light for the month, and you're going to see that when we flip over to the income statement. So those are sort of our high-level stats for the month of October. Any questions on that? Okay, I'll move on to the income statement. Our gross revenues for the month at $25.8 million were about 1.5% behind the budget. Inpatient was actually below budget, but outpatient revenue was actually 4% above. And the reason the inpatient revenue, even though the days were close, our ICU utilization was low relative to budget, and the case mix, so the revenue intensity of the patients that we did have inpatient was a little bit less than what we had budgeted. And whenever you have a high delivery month, if that's 43 of my 200 admissions, those are low case mix, low revenue compared to inpatient. And so that always drives that number down a little bit. So our gross was 25.8. Our adjustments and bad debt were pretty close to budget, just shy of 21 million. And our net revenue, our revenue cycle leader is here, but we had a good month. Our accrued net was 5.06 million, 200,000 better than our budgeted number. And then when you get down 2 lines, you see where we really had exceptional, and this has been a trend for the last few months. It will at least carry us through November, December, and then we'll see what the state does in the second half of our fiscal year. But anyway, our other revenue and essential access numbers were really high at 2.1 million and 2.7 million each, so that created a $3.7 million favorable variance for the month. And so when you look at the total net revenue, we actually had 14.7, budget was 10.7, so we're playing with house money for that $4 million favorable variance. Then on below, you see actual expenses, salary and wages and benefits were below budget, actually, slightly favorable to budget. Our contract labor, though, was not favorable to budget, pretty much knocked out the favorable variance we had with salary and benefits. But otherwise, our expenses sort of unremarkable. At 11.7, the budget was 11.5. But with that great benefit on the net revenue line, we actually had a profit of $2.9 million. for the month. We were budgeted to lose $772,000. And then if you look all the way across at the year-to-date, you see that we're at a $5.6 million positive operating margin compared to last year, where we were at a negative $5 million for the same period. Now, I will say, because people think that because you're making this money, you've got a lot of cash, but unfortunately, we have had to spend about $4.2 million of our own cash to pay for capital because we haven't had access yet to the Metro capital. That's awaiting the subsidy confirmation in the Metro budget, in the Metro audit, I should say. And it's not just us. Everybody that was beneficiary to that $1 billion surplus is waiting as well. So a very, very good month. It would have been a decent month even without this unusual other revenue, but with that, it made it a tremendously favorable month for the hospital.
Excellent. Good job.
It's all yours. And we had a good collections month, which you'll see too.
And I know we've been making some strides in that area. I know that's part of your
Dr.
position.
Blackledge, yeah.
Yes, and so I think that has moved in the right direction, it sounds like. Excellent. Okay, revenue cycle.
We do need approval for the
I'm
financial
sorry.
statement, sorry.
Moved on. Yes, action for approval. Do you have a motion to approve the financial statement for October 2023?
Move approval.
Second. Question, all in favor?
Aye.
Thank you.
Yes, sorry about that. All right, moving on to revenue cycle, Dr. Buckledge.
Thanks, Chair. There should be a slide up here, but as Bruce has shared and started, that was the best performing month. It was also the first full month that I had with the team. That's right. All right, sounds good. Thank you, Chair. I will start over, rewind. But as Bruce has said, that was our best performing month for the calendar year, 2023, actually. And it was also my first full month working with the team, side by side, elbow to elbow. So I'll just walk through a little bit of it. But number one, it was very much open and engaged conversation, focused on the measuring and monitoring of all the activities, being transparent, putting that information in front of the team so they can recognize, ingest, digest, if it needs to go further within the cycle. So that was our result, and we were excited and delighted about it. Many of the processes we put in place have remained today, and so it's really checking that off over time periods. We can go to the next slide, and if I reflect too, cash was 54.1 in combined cash for 2023 calendar, and then the year prior it was 49.4, so that was a difference of 4.7. As it relates to the unbilled activity, this is where we want to make sure that every charge, every claim, anything that can generate cash for the organization, that we get it out the door timely to that third party that's going to reimburse us, whether that's the patient or whether that's the insurance provider. And so in understanding that, we ended October at 5.82 days, which was great when you look at the trend. And that's, again, from reviews of internal and external assessments, working with the team, inking out our inconsistencies, and then doing some show and tells just in time. That's the real benefit of it. You can go to the next slide there. We talk about our denials management. So we ended October with about 300,000 in fresh denials, meaning where we dispute with the insurance provider, where the patient came to us and we couldn't understand whether it was eligible for this insurance benefit or that insurance benefit. And so what this is for us typically is often a delay in receiving the cash. It does not mean that we're not going to get to it, but we do have a delay with that population. It was about 300 at that time. And so we do have teams focused on education. We've also just loaded some into our health stream, some different modules today for our teams. And our goal is to resolve all the low-hanging fruit, those opportunities, meaning consistent recurring type errors. And I think that's it for now, but we're continuing to make progress within the revenue cycle. Happy to entertain any questions, thoughts.
Have you set out goals for your team?
Yes.
Have you had an opportunity to set out goals for the team and kind of looking at the trends of where you think that you can be realistically and the time frame around that? Can you speak to that a little
Yes,
bit?
so we have about 7 teams. Each team has like 3 or 4 objectives. We have 7 teams functioning now over a period of 8 weeks. And each team has a targeted goal. For example, eligibility team to reduce eligibility errors by X by this time period. And so we have 7 teams. Each team has a goal and objective. And they see the big picture because when we step back, all these teams really fit in together. So you have thousands of transactions, probably millions of transactions if we really get down to it every day. And they have to be managed and monitored. And when you see something that is above or below the threshold, we have to act on that, right? But we do have specific goals. And everyone sees the cash every day, too. There's a daily cash report that comes out. They're able to see where we are. So it's rah-rah, yay, yay. You know, give a hug, give some advice if needed. But we are very aligned when it comes to the goals. Yeah.
And do you have any idea what that impact will be once you hit those goals? What does that
Yes.
translate to, I guess?
It translates to 2 things, cash acceleration and net revenue improvement. So one example is the 3rd quarter. If I look at October, November, and December, I have that right here, October, November, December. So the impact there was about, I think it was 9%. So an increase of 9% as it relates to net revenue improvement over the prior year. So those are the items that we want to look for. We want to look to say, hey, are we making a difference and how can we make a difference? And we want to be able to share, here's what the goal is and how do we track towards that goal. Yeah. And that's just one statistic, kind of one stat from the performance of that time period. Yeah, and so if we look back, so quarter 1, we collected 12 million, quarter 2, 13 million, quarter 3, 13 million, quarter 4, 14 million. So you want to see the cash acceleration. Now you yourself know at some point we're going to hit a ceiling on acceleration. So you'll probably hear a little bit later about other strategies we have in place to get and acquire additional net revenue because we've got to have more. And what we are doing within revenue cycle fits and falls right in line with the growth and strategy for the organization and the mission of the board. Yeah. You're welcome. I'll take a thumbs up any day. Yes. Real live emoji, right.
Okay, thank you. Next item on the agenda is contracts and capital purchases. First on the agenda is the community health marketing. Ms. Poole?
I just didn't want to take everything down with me. So before our 2 board members of the Finance and Contracts Committee, we have completed the RFP process for the Marketing, Media Relations, and Communications RFP that went out on October 6th. And just as a recap as you go through, we had put the RFP on our website to make it public October 6th. In addition to that, I personally sent out 15 emails requesting responses for proposal. Of the 15, I had 4 that submitted an intent to respond, and of the 4, 3 actually responded. I also received emails from 3 other agencies who were part of the 15 I emailed, where they pretty much said, we appreciate it, we're just not interested in responding to the RFP at this time. As you go through the analysis, and as part of the RFP, it just goes through the background of what we were looking for within the RFP, specific to strategic positioning, public relations, media relations, communication strategies, community relations and stakeholder strategy, communication plan, public affairs, government relations, and management. So when the RFPs came in, the initial 3-member RFP team consisted of myself, Kathy Poole, Chief Marketing Officer, Tom Cooper, who is Director of Procurement, and Susanna Sells, who is the Director of Contracts. So we went through the first tier of evaluation, looking at their project approach, experience and qualifications, and commitment to diversity, and scored each one. We then, even though it wasn't in the RFP process, we have a lot of stakeholders within our own organization. This is not just about Nashville General Hospital. We have the Nashville Healthcare Center. We have the Nashville Diagnostic Imaging Center, which is going to be our first standalone imaging center. So I wanted representation from each of those. And we also have the NGH School of Health Sciences. I also pulled in a couple of members of the executive team, ELT, and had them go through and sit in on the actual presentations, because what we decided is of the three that presented, they were all within the upper, like 75% and above on scoring. Respectively, they were at 74, 68, and 69. And because there were only three, we were like, let's bring them all back in and do the presentation with this team and allow them to score based on presentation, and that matrix is in here, and partnership potential. After we've went through that process, the original three of the RFP team, myself, Tom Cooper, and Susanna Sells, then went back through the fee schedule because we asked that that be sent separately than the RFP response so that we could see, did they put everything within the scope of the services, and how did that align with what we have. So another document I handed to you, and I thought this was a great value analysis that Tom Cooper brought to the table so that when we went through each of the three fee schedules, we would be able to determine, okay, quality, price, recommended decision. And when you look at the pricing, there is a stark contrast. So after reviewing the three pricing and determining what the best value was for our organization, we did choose and present to the board for approval community health marketing. In addition to that, I went and reviewed Metro's RFPs and items that were part of their online available to the public and pulled out all their marketing RFPs just so we can get comps. Of the four, they all pretty much fit in line, and I've even added the contract abstracts that I found online. Many of them are anywhere from a 7-month PR contract to the tune of $1.2 million to a 3-year with an option to extend to 5 years, $2 million contract. Any questions?
These numbers, okay, I'm looking at this graph under E, Metro Marketing. These numbers are yearly amounts?
Those
or-
are the total for the contract.
Okay.
Have you done any comparisons from other city hospitals and their marketing budgets? Because I think comparing some of these entities, while it's important to know from a government perspective, I mean, you know, they don't do the same thing, so.
And I just had that up. I realized I didn't grab that copy. So when you do look at how hospitals handle marketing departments, it's very hard to go with healthcare because there's so many varying types of healthcare entities, from pharmaceuticals to hospitals to clinics, that they tend to just lump it all together. When we were reviewing this earlier this summer, the marketing budget that I have is 0.7% of our operating expenses, And typically, you will see about 3%.
So can you tell us who the other two?
Oh, yeah, I have them over there as well. So, one is Red Pepper. They are a local firm that we have experience with as well. And then the third firm was Davidson. They are out of New York City. They have a lot of healthcare experience. So there was very heavy on the expense as far as doing the deep dive that we did a few years ago. So when we looked at, when I presented how much we had spent on marketing at 1 year, we were over $750,000 just for an 8-month period because we did a workshop and we brought people in from council, the board, and everybody, and we laid out a whole creative plan and worked on personas. And I don't think, in my opinion, we're there yet to go back and spend those dollars to do that again. Hearing what I heard this summer about the price of the contract. So it's really, where are we going to get the most bang for our buck? And right now we have a lot of PR, a lot of community engagement that we need to be doing, especially as we're expanding our footprint into the Bordeaux area. We already have design collaterals. We have brought on people that weren't here back when that occurred. So Kaylin, as my marketing manager, her background is graphic design. Chanel, that we just hired for our social media, kind of plays into this as well. So it's kind of moving some pieces and parts around.
It looks like the prior 3 contracts, 2 of the 3 were awarded to the same group. Is that accurate?
That is correct. The same parent group. I will say Red Pepper was part of the first community health marketing. They kind of had an LLC. And then currently community health marketing, and I apologize, I can't remember if you were here when Amanda with Punching Nun Group and Misha Maynard came on board. So there was a little bit of restructuring going on with that as well.
So I guess the question is, for me, have we set out goals in the marketing area? Have they achieved those goals in the past? What were the contracts that we had in the past? Were they a similar contract, similar dollar amount? And kind of, did we hit those success metrics with this company? It just feels like a big number. I understand marketing is expensive, but I just want to make sure that, also we're being thoughtful about other groups that could be out there that could be bringing different type of thought capital in with a fresh set of eyes rather than kind of just going back and retapping the same group. So again, I understand that there's a difference in the cost, but
so that was the intent of the RFP. So
Yeah.
we did have a couple of different firms say that they were going to, and then 2 did not choose to. I will also say this. There aren't a lot of firms, in my opinion, and I have been with this organization 27 years, who the challenge that we have sometimes from a PR standpoint can be overwhelming.
so you think this
So
firm
I think there
gets
is
that? I guess, is that what you're trying to say? Trying to.
You really have to want to be in the middle of this. And they didn't submit an RFP. I mean, I reached out to 15 different agencies. And we got back 3. And again, I want to go back to the terms. It's an 17-month term, I believe, with the opportunity to renew for 2 additional 1-year terms. But there's also a 30-day out on this contract. So if anything changes or if we're not seeing anything, we're not stuck with a contract. We have developed KPIs for every area that we'll be looking at. Because our intent, especially when we're now getting into the Bordeaux location, there are a lot of community stakeholders we've been talking to, community groups, the metro agencies, that we're now able to kind of get out there and say, hey, you know, we've got this incentive program and it's been trending up every year since since 2015 that we've been able to get the numbers for, but this is even better, especially with the Diagnostic Imaging Center.
And the last contract with this group, was that a 3-year contract, or was it also a shorter contract with an extension?
The original community health marketing contract was 8 months to do that first big deep dive, and that was like 2018, 2019. And then it went into a 2-year contract. And then it was brought back up in 2021 for another 2-year contract, and that's the one that expired June 30 of 2023. And we came back for approval, and then the board requested an RFP, which we did.
And looks like a couple of the metro departments are still dealing with Finn Partners. Were they given the invitation to bid?
Finn Partners, after our last RFP, because they represent another Meharry, they did not want to move forward with us.
With our contracts, do we have built in, kind of like we do as board of directors, conflict of interest that they sign with us as part of the contract?
I'm looking for my contracts person.
I just
They
think it's a good process going forward to add into all of our
They
contracts
should be in
that
all
we
the
do. So it's a
BBA
disclosure.
agreements.
Yeah,
Correct.
it's just a
Yeah.
disclosure to make that visible. So especially when you're dealing with this kind of money, and we're
Definitely.
a government entity. So I just want to make
I
sure that
agree.
we're doing all those. So that's something we can put as a takeaway to make sure that that's part of
Okay.
contracts going forward.
I assume what we're doing is approving the report. We're not,
It would be an approval to the board to, a recommendation to approve this contract to the full board.
okay. I wonder if we can just approve the report, because the board had asked for this information before the board meeting, and it was not forthcoming. So I don't feel comfortable approving the recommendation, but we can approve the report. And I think the board, it's up to the board to approve the contract.
Is that only because this information wasn't forthcoming, because we don't typically default to the board on any other contract?
Well, it is because the board asked for that, and my understanding was, that was agreed to. and
My,
it- and it
I
didn't.
apologize. My understanding was we would make it available if the board members came, but we typically don't send RFPs.
Well, the minutes of the board meeting will reflect
Okay.
that.
I
the
apologize,
members
then I will,
of board, so I think, it doesn't mean, the board can't approve the
Right.
recommendation, but only 3 members of the board now have any awareness of the outcome of the process.
oh,
So I think it's only fair to them to hear it. But this is a report to the Finance Committee, and so I move approval of the report.
okay.
I would second that approval of the report. The question I would have is, do we just need to defer our recommendation until it gets through well, the board has an opportunity to review the contents and ask questions. So we would just be pushing this to the next finance committee meeting. Is that? there
Not
a
to the full board to approve?
Well, I don't know if they're going to have time to do that, if they're just getting the information, I guess is the question.
Oh.
Right? So if we hand them this today, it feels like that might be quick. So maybe we can just push this. So the motion, maybe amend the motion to defer to the next.
So just
finance
as an
committee.
and I'm purely just asking the question.
Yeah.
Is this the precedence on all contracts moving forward?
I don't think it's the precedent on all contracts going forward. I think what you're hearing Buzz say is that he doesn't feel comfortable moving forward with the approval from Finance Committee, being that there are some questions and it seems like some follow-up that still needs to be had for people to be comfortable with. It might be premature to have us move that to the full board. So my recommendation would be to defer it out a month, bring it back to finance, give people a chance to ask questions and be comfortable with it, like we've had a chance to be. If that's not a major issue on your side, if there's anything that would be a
Not an issue.
hindrance, to. Okay. Is that-
Yeah, I guess the question is whether, if we approve the report and take it forward, whether the board could still elect to, they could elect to defer it, or they could elect to go ahead and approve it.
I would like to weigh in and say, I would prefer to include them in this discussion, and then the good of the board is saying, yes, I agree, let's postpone that until next month, and we can follow suit with that, but I wouldn't want to take that from them. They may have time during the meeting to look through and get their questions answered and feel comfortable. I don't want to rob them of that opportunity, and I am also a little bit concerned about the optics of it, because it does feel like there's more attention and more scrutiny to this particular RFP than any other that we've had, so.
Yeah.
Oh, sorry.
Excuse me. I heard you.
I'm done.
I heard you. Okay. Are you comfortable with that? Are you comfortable with that disposition?
Yeah.
Crud, you want me to say it again? Okay. Little person. All right. I would like to make the recommendation that we continue this conversation with the full board meeting, if you all are in agreement with that. I just don't want to take away the ability for them to ask their questions, and maybe they will feel comfortable to come to a conclusion. And I also am a little concerned with the optics, and that we are treating this process, this contract in particular, different than any other contract that we've done before. So that's it. That's my recommendation.
Perfect, thank you. Okay. Since we're not making a recommendation for approval, we're pushing to the board. I don't think we need a recommendation for approval. It's just more of an informational item at this point. Is that, okay. All right, we will move on to the second, Quiller telepsychiatry inpatient and emergency units.
Yes, ma'am, Madam Chair and fellow board members. So I'll be presenting two separate contracts. They are both under $50,000, but all clinical contracts do come to the board. One is for the inpatient units and one is for the emergency department. We have not had a psychiatry resource for our organization in either of those areas since September of 2022. Clear is a telepsych company. They will provide on-demand services to us for psychiatric consultations in our inpatient and emergency department. We have asked for about 14 per month. It'll be $3,900 per month and almost $48,000 a year. We are committing, if you look on here, there's not an out clause because we committed to do a 1 year with them, and at the end of the 1 year, evaluate the continuation of that relationship. To see how it was going. We can't prematurely do anything, I think, before that time. As you know, psychiatric resources are short nationwide, and this gives our hospital medicine and ED providers a resource to tap into. They have a 90-minute response rate. As far as if we put in a consult, they have to respond within 90 minutes, as well as there'll be credentialed staff, medical staff in our medical staff office. They currently serve Baptist Memorial, Williamson County Medical Center, Cookeville Medical Center, Life Point, and Erlanger. And if approved, Nashville General. I'll take any questions.
Could you tell us the history? It sounds like we did we have in-house coverage
we-
until 22?
In September of 2022, we received notice from Meharry that they were moving their psychiatric program and residents to a different site. The psychiatric residents kind of saw our inpatient population. They've never served the ED. During that time, we implemented a mobile crisis counselor within the emergency department who helps with assessments. But when we have holds, there's no movement until we get a bed, and sometimes we can move those patients out quickly if we have a psych consult that can adjust meds, help us with a follow-up treatment plan, and so that's what we're attempting to do now. We have been trying to actively recruit a psychiatrist, but as I said, they're short and they're very expensive.
And I'm guessing, I mean, to have 24/7 coverage, you'd have to have probably 3 psychiatrists.
We really don't need 24/7 coverage at this time, and to be honest with you, Dr. Martin, during that time it was offered, we don't need it. Bruce and I looked at those metrics, and we were seeing then about 6 or 7 consults that were actually being answered a month. And so our hospital medicine physicians have been managing it since that time, as well as the ED. So we're just trying to provide them, a resource to move things along when needed. And if we need to bump that number up later after this year term, we can do so.
So we are looking to recruit.
We are.
Okay. And this contract would be for?
It's a 12-month term, and we have the option to look at terms at the end of that 12 months.
Okay. Move approval.
Thank you.
Is there a second? Second. Any question? All in favor?
Aye.
Motion carries. Next is the CMS imaging.
Yes, Madam Chair, good evening, and other board members. CMS Imaging is our 128 slice CT scanner. We've had it for a little, right at a year. So the warranty is expiring, and so we're seeking a 5-year contract for coverage. The scanner, we did go out to bid, but for the newness of the scanner and the complexity of the maintenance on it, the only thing that the companies that we probed or asked for bids, the only thing they're going to do is charge me a management fee and go back to the source that I'm going to directly. Because of the proprietary software on the machine, it's too new for any third-party vendor to try to handle.
So this was a new scanner a
Yes,
year ago?
Right, that we installed a year ago in the downstairs.
What's the life expectancy of a?
7 years.
Okay.
We normally keep them probably around 12, but normally life expectancy is 7 years.
Okay. Move approval.
Any questions? All in favor? Aye.
Okay, the next one is Sky Alexander. This is for the maintenance of the gardens that we have here. And the reason why you see no bids attached to this one is because the scope of the project is so small that I can't get anyone else to come in to do that work. So I searched high and low, trying to find a vendor that would do that work for us. And so we hired the vendor last year, and it was below the threshold of 50,000. But this year they went up because they ended up getting another party to take care of the garden. And so that's why it went over the 50,000 threshold. Bruce and I wanted to bring it to the board so to get approval on that. But it's very hard to get someone to do a small job these days here in Nashville. I thought at one point Mr. Nairmore and I would have to go out and do the bed ourselves. But we didn't feel like Dr. Webb would approve of that time utilized throughout the day.
He doesn't mind, though, if we're out there pulling weeds on occasion.
Exactly. Any questions?
No, seeing no questions, I would ask for approval for the contract with Sky in the construction.
Move approval.
Second. Second. Question, All in favor? Aye. Motion passes.
Okay, then.
Last contract would be the Metro Center rental.
Yes, so we're seeking a 36-month approval on some lease space for provider in the Metro Center area, 131 French Landing. I think Dr. Blackledge sort of alluded to that earlier in her conversation with our strategy for revenue growth. And either one of us would be glad to answer any questions.
Is this a space we're using now?
No, sir.
Okay.
This is in addition to the current space that we're utilizing.
And do we have more employees? Is that why we need more space, or?
Well, that's the
Yes.
plan. Yes, absolutely. So it's part of our growth and development strategy. And this is existing space that we'd like to utilize.
How many staff do you have now, and how many would you like to have?
How many staff will we gain? Be 7.
So are you currently existing staff that we have?
Yeah, I just want to hear why we're doing this, basically.
So if we talk about
Sounds
why
like-
we're doing it, if I can go back to Madam Chair's question to me earlier, which was, goals and revenue. So the goal in terms of collections is always pursuing the net revenue.
Yeah.
That's first goal. Now you can pursue the net revenue, we're gonna hit a ceiling. We have to have incoming growth and incoming revenue. And so when we think about our sustainability plan, our plan has to be to go out in the community and acquire existing net revenue. And so part of what Dr. Brown is asking is approval for this lease space so that we can continue to see patients in the community in this lease space. And that's gonna bring, as you well know, revenue to the organization. So we're talking about sustainable growth.
You said you're going to see patients there?
Yes.
Okay, so you're going to meet with them about,
Yes, we will see patients. We need a location within the community as part of our mission.
Okay.
We have a plan. This is a 3-year part of the plan. We projected it out through 5 years, but we have to have sustainable growth. So when we rewind a few minutes ago back to collections, and we're averaging 4.9, 4.8 per month, how do we see growth there in that space? Our trajectory has to be for growth. And of course, that's why we're all here. We're all supporting that mission. We're all participating, but we have to see the future.
okay, and you need this space to do that,
Yes.
Yes.
okay?
I have a quick question. I see that I'm sorry, were you going to add anything else to Dr. Martin's question? Okay. I see that the lease period is to begin the beginning of February, and I apologize if I missed this. I was stuck in nasty wet traffic. So I apologize if you've already talked about this a little bit. But have you identified which providers, which specialties will go here? Or is this for recruiting new folks, or?
Yes,
You have this. I apologize.
Yes.
I just-
So we have the staff and the providers already for
Okay.
that space.
What specialty is it, if you don't mind me asking?
It's primary care, and we'll have cardiology, urology rotating through just like we have at our other off-site areas.
Oh, okay. I'm sorry. I hate being the person to ask
No,
the question.
that's
It's
fine.
already been
That's
said,
fine.
but
Great
I
question,
needed
Dr.
that.
Hudson.
Needed that piece. Thank you.
Is there a separate cost for build out? This is just the rental space agreement?
This is just going to be rental space, Madam Chair. We're not going to do any build-out at this time. This is just strictly rental space.
And have we I'm sorry. I'm on a roll. I'm sorry. Have we maximized the existing space that we have? I'm sure. I feel like you're saying yes. That's why we need it. But I just needed to hear it. So we have nowhere else to put a provider and see these folks like in our existing spaces that we're already leasing.
Actually, to answer your question, downstairs, I don't have any space. As we bring on providers, I have no more space. Actually, I really have no more space for people in this building. I have like 1 or 2 offices left. So we pretty much maximize the utilization of all the space that we have currently.
Okay. Thank you.
You're welcome.
Have you looked at anticipated revenue of what's going to be generated in this site comparative to the cost of $182,000 to operate it?
Yes, and the revenue that will be generated is more than enough to cover our costs for this location. we have projected it out for 5 years, so we feel good about, not just feel good, we know
No.
that the revenue is there, is present, yes.
Move approval.
Second.
Okay, any question? All in favor? Aye, motion carries. There's nothing else that should complete the Finance Committee meeting on the 25th, so thank you.
Right on time.
Thank you.